Good Wednesday morning. I'm Mabel, Jong. This is WHCC TV coming to you from Washington, D.C. We're on day 4, our final day of the World Healthcare Congress. Thanks so much for joining us. Our next guest says that we need to see more nurses in leadership positions, and she spent the last 20 years really getting nurses to those top spots. Welcome to Lisa Sundean, who is with US Boston at the College of Nursing and Health Sciences.
Thank you. It's great to be here,
Thank you so much, Lisa. So why do you think it's so important to get nurses really at the table to talk about some of the decisions that are being made in healthcare?
Thanks for asking. Well, you know, nurses have the most point of contact with patients and patient populations. Certainly physicians do as well, but there are more nurses in the country and in the world than there are physicians. And we have the time to have those really deep, intimate interactions and conversations with patients to really understand what their needs are. And it turns out we're very smart. So why not bring that information to the table where strategic decisions are being made about the direction of healthcare, the types of services to be provided, the ways that we inform the care that we provide, and how we work with our populations.
Well, it seems like an obvious thing to do to have these folks be in these top spots, but why have you spent the last 20 years really trying to get people to agree with you?
Well, mostly because it hasn't happened.
Why hasn't it happened?
There are many more nurses right now moving into executive leadership roles, and so we're really happy to see that. What we're not seeing is nurses being engaged on boards of directors, and so, you know, that's really where the strategy happens.
And the investment.
Right. So I think that, well, research tells us that many board leaders do not understand that nurses have the capabilities and the qualifications to serve on boards. So I'm spending a lot of time talking with board leaders and nurses to say, hey, you are qualified to sit on a board. You do know. Now, is every nurse interested in this? Absolutely not. Not every physician is interested in this. Not every business person is interested in this. But there are many nurses who are very well qualified and have a lot that they can contribute to those board discussions. But many board leaders don't realize that nurses are capable. In their minds, they've stereotyped nurses that they're at the bedside, they're taking care of patients who are sick, and they're only at the bedside. But in fact, we have a broad range of activities and qualifications to serve on boards.
Okay. Does it also begin perhaps when someone chooses to be a nurse, that's a certain type of person, so their career decisions have already pinpointed a certain type of person that may not want to rise to the next level?
Yes, and in some ways it goes back to stereotypes, whether it's the stereotype that the nurse, he or she goes into, I'm going to be a nurse because I want to be at the bedside, and we need a lot of nurses at the bedside, absolutely. We need them in the communities, we need them in schools.
They're busy
right.
already.
But some of us have decided that I can care for my patient population by being at the table and contributing in the decision-making process for how healthcare and health is shaped for our populations.
Okay, so what is part of the work you're doing to get the word out that you'd like to see more of this at executive board meetings and the like?
Well, first of all, I serve on several boards of directors, and so I'm very clear that I'm a nurse here, and this is my point of view and my perspective, and without shoving it down the throats of anybody. But you know, I do it very tactfully, and I think people see by example that, oh, she really has contributed, and we really appreciate the work that she has done as a nurse. I serve on a national coalition called the Nurses on Boards Coalition. I actually co-lead their research group. So we are trying to collect research and conduct research about nurses on boards and about, you know, the flip side of it. What about executives who are engaging nurses on boards? What about executives and board leaders who are not engaging nurses on boards? What is that all about? So we we can come to a better understanding. I am also, aside from the Nurses on Boards Coalition, of course I'm a nurse scientist, and I am working with folks around the country to conduct just this type of research. So not just talking with nurses about what they're doing as board leaders, because some nurses are serving on boards, but really looking, as I said, at that other side to say, you know, who are you who are engaging those nurses on boards, and we want to know what you're seeing, and if you really think this is value add, could you talk to your colleagues and maybe promote this idea with them? So those are the kinds of angles that I'm using to promote Nurses for Board leadership roles.
Is it working?
Not yet.
Okay, so the work continues.
It continues. Unfortunately, as much work as we have been doing nationally over the past 5 years, specifically, this is again with this Nurses on Boards Coalition, we're finding out now through research that we are not really moving the needle, at least not in terms of hospital and healthcare systems. Now outside, maybe in the nonprofit world or in corporations, maybe it's different. It's hard in a research sense to wrap our arms around that. But in hospital and healthcare systems, not quite so much. And that's why we want to get to the board leaders and the executives, because we feel that we need to have those allies who are promoting us and who are willing to pull us up so that we don't feel like we're always knocking on the door, let us in, let us in.
Right,
Yeah.
and hopefully it won't take 20 more years.
I hope not.
Yeah.
I hope not. You know, historically, and I mean way historically in the 1800s, late 1800s,
Okay.
and early 1900s, nurses ran the hospitals. There were very few physicians in hospitals at
Yeah,
the time.
we forget
Nurses ran
that.
the hospitals, they cleaned the hospitals, they took care of the hospitals, right? When we turned toward more of a business model of healthcare is when all of that shifted, and medicine became forefront. And of course, in the 1940s, the Hill-Burton Act came in, and we had hospitals cropping up all over to take care of our citizens, which is really great. But that drove healthcare from community into hospital. Nurses at that time, while some were running hospitals, most nurses were in the communities. That drove nurses to communities, back into the hospitals rather. And then that's where business and medicine was forefront. And so I think at that time nurses kind of took a back seat. So that's kind of the historical root of why we're not there at the table.
Lisa, thank you so much for your time today. Really appreciate it. May I ask how you've enjoyed the conference this week?
I have absolutely loved this conference, being here, listening to all the different perspectives and frameworks, and the new way of thinking about health and healthcare. And I was delighted. I mentioned this to you earlier. Two things. First, I'm hearing the word health more than healthcare. So important that we understand we need to be building a healthier society. And the other thing that I've heard so much is the word love. And coming from physicians, which I'm sorry, I just don't ordinarily hear, that the love for patients and the need to really socially connect with our populations so that we can build health. It's beautiful.
All right. Love ending it there. Thank you so much, Lisa.
You are so welcome. Thank you, Mabel.
And thank you for watching. Stay with us.